Let's start with a truth that is, well, often invisible to those of us with easy access to healthcare. Over 1.1 billion people globally live with untreated visual impairment or blindness.
Mm.
And get this, here's the most challenging part of that number. 90% of those people are in low and middle income countries.
It's an invisible burden.
Completely.
Okay.
Just crushes potential, it hinders education, it reduces productivity, and it makes daily life fundamentally unsafe.
And it's an accelerating crisis. I mean, if we don't scale up interventions, projections warn that by 2050, that number could hit 1.8 billion.
Wow.
So the traditional model of, just building a big, expensive eye clinic in a city, it just doesn't work. It's inadequate.
You need something that can reach people where they are.
Exactly. You need strategies that get to populations where specialists and high-tech tools just don't exist.
And that brings us right to our focus today. We're doing a deep dive into peak vision.
A UK-based social enterprise co-founded back in 2015.
By an ophthalmologist, Dr. Andrew Basteris. And his journey really began in rural Kenya, where he was just confronted with this massive problem, widespread eye disease everywhere.
But the tools he needed and the specialists who knew how to use them were completely absent.
So the innovation here wasn't about inventing a new medical procedure.
Not at all. It was about fundamental innovation in delivery. Dr. Basteris realized his expensive, complex equipment was useless if the nearest patient was a 2-day walk away.
And he saw the smartphone.
He saw the smartphone everywhere and asked that key question, why can't the diagnostic tool be in every single pocket?
And that idea became Peak Vision. The acronym actually stands for Portable Eye Examination Kit.
And their mission is so clear. It's to, and I'm quoting here, create technology and health information that enable health providers to offer high-quality, sustainable eye and health care for all.
The vision is even simpler. Sight and health for everyone.
So our mission in this deep dive is to really unpack how Peak uses this low-cost, mobile tech and a truly community-powered approach to bring quality eye care to people who would otherwise have no access at all.
They're making this massive, invisible burden finally visible.
And diagnosable. And treatable.
So the idea came from that scarcity problem he saw firsthand.
Right. But Peak's value isn't just the software, it's a whole integrated solution.
It addresses both sides of the problem, right? The demand and the supply.
Exactly. On the supply side, they strengthen local capacity where it really counts. And that leads to this democratization of care.
So instead of relying on a handful of ophthalmologists who are miles away,
they train non-specialists, people like local teachers, nurses, community health workers.
So they can do the basic vision screenings right there in the schools and villages.
Meeting people where they are, literally.
That empowerment model is the key to scaling, I imagine. And the main tool for this is Peak Acuity.
Yeah, so think about the design constraints. The biggest one was literacy. How do you test vision reliably when people might not be able to read?
And the solution was a smartphone app.
A clinically validated smartphone app that turns a basic Android phone into a medical device.
I find the design of it so fascinating. It doesn't use letters. It just displays that standard tumbling E on the screen.
And that's the genius of that simple choice. That tumbling E chart means it doesn't matter what language you speak or if you can read it all.
The patient just points in the direction the E is facing.
Up, down, left or right. It's incredibly fast, usually less than a minute per eye, and it works for a 6-year-old child just as well as a non-literate elder.
And crucially, it has to work in places without stable electricity or, any kind of connectivity.
That's the core of it. The critical function is its offline capability.
So it works without a data connection.
Completely. It turns an ordinary phone into a screening tool that works in the most remote areas imaginable. That is a huge requirement for last-mile delivery.
Okay, so the tech is brilliant, but execution is everything. Screening is just the first step. If you identify 1,000 kids who need glasses, how does Peak make sure they actually get the care? How do you close that loop?
That's where the data platform kicks in. This is what turns a simple screening into an actual actionable referral.
You're talking about Peak Capture.
Right. The data management app the field workers use. It securely collects all the patient data, and crucially, it automates the referral process.
So it flags patients who need follow-up.
It flags them, generates digital lists, and can even notify the nearest clinic that a patient is on their way. People don't slip through the cracks.
And this all works offline too, and then syncs later.
Yes, exactly. They sync it when they get back to a place with connectivity.
So once Capture has all this data from the field, who is sitting back at, say, the Ministry of Health trying to make sense of it all.
That would be the Peak Admin Dashboard. It's the cloud-based platform that pulls together all that field data.
Giving program managers and health officials a real-time view.
A real-time view. They can see on a map which communities were screened, who was referred, and most importantly, who actually received treatment.
So they can spot the bottlenecks?
Precisely. Maybe transport is the issue, or one clinic is overloaded. It lets them allocate their scarce resources so much more effectively.
And the platform does more than just track patients, right? It provides macro-level data for policy.
That's its power. They have specific tools for this, like SEHRA, the School Eye Health Rapid Assessment Tool.
Which is so critical because 80% of learning is visual.
80%. So the data from SAR shows governments the exact scale of vision problems among their students, which helps them plan effective screening programs.
They've also digitized some established public health surveys.
They took a huge step by digitizing RAB7. That's the latest version of the Rapid Assessment of Avoidable Blindness survey. It's the gold standard.
And by making it a fully digital workflow.
They speed up that whole feedback loop. From data collection to policy recommendation, it's just dramatically faster.
But wait, if you're training non-specialists like teachers to do this, how do you make sure the data quality is high enough for something like RAB7? You know, something used to justify millions in spending.
That is a crucial point. It comes down to two things. First, the Peak Acuity app itself is clinically validated, so the diagnosis is reliable.
Right.
And second, the training is intense and structured. The system itself is designed to minimize data entry errors, and the dashboard can flag weird data patterns instantly. So the evidence they give to governments is rock solid.
So you've got Acuity for diagnosis, Capture for patient flow, Admin for oversight. It's a true end-to-end system.
It really is. It transforms the expertise of an eye hospital into a sophisticated clinic in your pocket.
All right, this is the crucial pivot point where social impact meets viable economics.
Yeah.
How did Peak Vision structure itself to keep that social mission protected?
They built a really clever hybrid business model. It has 3 interlinked entities. First, there's the Peak Vision Foundation. That's a UK-registered charity. It raises grants, donations, and oversees the impact mission.
And then there's the revenue generator.
That's Peak Vision Limited. It's the trading company, the social enterprise, and it's wholly owned by the charity.
So its only shareholder is the mission itself.
You could say that, yeah. This company develops the tech and runs the programs for clients like governments and NGOs.
And if they make a profit on those programs, where does the money go?
That's the key. All profits generated by the trading company are legally transferred back to the foundation for reinvestment.
So it's a self-feeding, virtuous cycle.
Exactly. Commercial activity directly funds the social mission.
That said, earned income is often slow to grow, especially with all the R&D costs. Are they fully self-sufficient?
Not yet.
Yeah.
That's the challenge. The earned income doesn't yet cover all the costs, so they do still rely on grants and donations raised by the foundation.
But the long-term strategy is to grow that program revenue.
Yes, to achieve that full financial self-sufficiency and remove the liquidity risk.
They've certainly been successful in scaling their reach pretty quickly. What were some of the key partnerships that enabled that?
Well, one early validation was winning the Rolex Award for Enterprise in 2016. That provided the seed money for the first pilots in Kenya.
Okay, that proved the model worked.
But the real turning point for scaling was the anchor partnership with CBM, Christian Blind Mission, in 2018.
CDM is a huge international organization. They must have brought more than just money to the table.
Oh, absolutely. They brought the infrastructure and the trust. CBM had existing on-the-ground networks, which let Peak roll out programs really quickly in places like Ethiopia, Pakistan, and Tanzania.
So they didn't have to start from scratch.
Exactly. They could plug right into established health systems.
And that infrastructure allowed them to prove the model could work nationally.
Precisely. The best example is the Botswana National School Eye Health Program. It's called PONOYEM, which means My Sight.
That was one of the first nationwide deployments.
It was. It validated that the whole system training local teachers to screen kids across an entire country could work sustainably within a government framework. It became their blueprint.
And the numbers really do reflect that growth. By 2021, they'd reached over 400,000 patients.
And trained over 500 people. Their targets are ambitious. They were aiming for over 100 programs in more than 15 countries by 2024.
So what does all this mean for global health? The impact goes way beyond just fixing eyesight.
It connects to fundamental human development. It aligns perfectly with the UN Sustainable Development Goals, the SDGs.
So it hits SDG 3, good health and well-being.
By expanding universal health coverage for eye care, absolutely.
And their focus on schools obviously impacts SDG 4, quality education.
Hugely. If 80% of learning is visual, correcting a child's sight is often the single most effective thing you can do to keep them in school. And by targeting underserved groups, they're also pursuing SDG 10, reduced inequalities.
But despite all the success, scaling in these remote areas must have enormous challenges.
Oh, for sure. The challenges fall into about 3 buckets.
Okay.
We've already talked about the first one, financial sustainability and the grant dependence. The second is pure logistics and infrastructure.
You're talking about reaching nomadic groups, dealing with intermittent power.
Exactly. And then there's the soft challenge, the one tech can't fix on its own.
Cultural barriers.
Yes, overcoming deep-rooted stigmas or fears about treatment. Rumors about eye surgery can cause huge anxiety. The supply might be there, but demand just vanishes because of fear.
So you need strategies that merge the human element with the smart tech.
And they have them. To tackle patient drop-off, for example, they use a simple but effective SMS reminder system.
A text message.
A simple text. It sends notifications to patients or their guardians about referrals, and studies show it significantly increases adherence compared to just a paper slip.
And for the deeper cultural barriers.
It's all about community buy-in. They train local people and run education campaigns to build trust long before any screening begins.
So it becomes a community-owned solution.
Yes. And the tech is designed for these issues, too, working robustly offline with simple interfaces for lower digital literacy.
So looking ahead, where does Peak go from here? What are the next big opportunities?
I think the most logical next step is sensory integration.
Meaning?
They have the platform, the network, the data architecture. They can use it for more than just vision. They're looking to include hearing screenings, for instance, maybe partnering with an organization like HearX.
So the same person doing an eye test could also do a basic hearing test.
Instantly turning a single-purpose tool into a multi-sensory diagnostic platform.
And beyond diagnosis, they're also looking to close that treatment loop even faster.
Absolutely. They're expanding partnerships with providers like DOT Glasses,
who make ultra-affordable adjustable eyeglasses.
Right. So imagine providing vision correction immediately, right at the point of diagnosis. It drastically improves the impact and cuts out the logistics of a second visit.
This deep dive really shows how Peak Vision marries frugal mobile tech with deep community engagement and data analytics. They've built a blueprint for last-mile health.
And their experience shows that innovation in process and partnerships is just as important as the product itself. They've evolved from just a tech provider to a service integrator. They link the whole ecosystem of care together.
So if Peak's system is a blueprint for any last-mile health challenge, and they can successfully add hearing care, think about this. How many other underdiagnosed conditions could be addressed using the same hyperlocal, smartphone-based infrastructure? If the phone is the clinic, how many medical specialties can truly move into that pocket? Something for you to consider as this model inevitably expands.
Thank you for listening to Mission Possible, innovating for the world's most marginalized. This podcast is built on the outstanding work of our students, whose curiosity and commitment drive much of the research and storytelling you hear. Each episode is grounded in academic research and shaped through close collaboration with our partners. To learn more about the research and partnerships behind this podcast, feel free to contact us. Thank you for joining.